Yes, colleagues, we are nearing the end point in the course of cardiodiabetes medicine. Today we are going to discuss on digital technology intervention in cardiodiabetes medicine. Today we are in digital era. In this corona pandemic, we are able to do everything digital. We stay at home, we do little work, and we learn. All our children, grandchildren do their education on digital. Therefore, it is a digital India. And in that, how to handle the the cardiodiabetes syndromes digitally. Cardiodiabetes, as you know, has two components, cardiology as well as diabetes. In what way both these things can be handled, both on the diagnostic side and therapy side, we will see. Definitely it will be an interesting one for all of you. Now friends, let us see where do we stand on digital technology interventions in cardiodiabetes medicine. The framework of this communication will be, what is digital health and why? What is digital cardiac health? What is digital diabetes health? What is lifestyle medicine? What is wellness? What is future? Maybe little, interesting to all of you. In 2003, WHO defined e-health as the digital data transmitted, stored and retrieved electronically in support of healthcare both at local site and at a distance. And initially it was e-health or electronic health, which was available only to desktops. It is connecting the care provider and user. Today, care provider and user have to sit across the table and then have an evaluation. But things are going totally different. As I told you, in these epidemics or without epidemics also, reaching the doctor by the patient becomes too much difficult. Reaching the patient by the doctor is also becoming difficult. Therefore, we need a platform which can connect the healthcare provider and the user, that's a patient, and beyond a personal visit, that is digital health, called as a virtual visit, can be on the mobile, you call it as a mobile health, can be on the desktop, you call it e-health or a telehealth, and there are also some more names as an iHealth, but currently the accepted terminology is digital health in digital era. I have a passion for this mHealth. Because when I was in the Commonwealth as a president, we were strongly banging on e-health, but we had a difficulty, but it was not possible for every human to own a computer and use a computer for health. But smartphones were always very handy, therefore we thought all healthcare aspects will finally converge to mobile, that we call it as a mHealth, which is now true today. We use our mobile phones for everything, for our food, for our ticketing, for our travel and everything. Why not for medicine? It's also being now possible with various types of apps. Why we need a digital health? That is, it nullifies the distance. Patient may be in USA, doctor may be in India in a remote city. It nullifies the distance. Around the clock, it could be monitored. We will see how. And reduces travel and waiting. I used to always say, patients pay more money to the transport than to the doctor's consultation, and thereby it reduces the cost. And there is today a globally health workforce. It is shortfall. Doctor is at shortfall, or nurses are at shortfall, which could be compensated. Quality. There can be an equal quality. Equality can be there. Uniform health system connecting doctors with patients. There are many types of digital health. We call an e-health. The common one is a EHR, electronic health record, paperless office. Patient is totally enrolled digitally, and all his history, diagnosis, therapy, treatments, complications are recorded. And e-prescriptions, patient sees the doctor or consults the doctor, prescription goes to his pharmacy and he is able to collect it. And telemedicine, reaching the unreached. There is a very remote village, the doctor cannot reach, patient cannot reach the doctor, whereas a telemedicine can always reach. And lot of consumer health informatics which could be done. And health knowledge, today we call it as digital learning. Digital healthcare, digital learning, Both of them combined form digital health. And today, all students are learning online. For doctors also, e-learning is the order of the day. And a lot of courses are coming up. Even APA is coming out. And with a lot of courses, cardio-diabetes medicine is also one. It's a health knowledge. And as I told you, mobile health, mHealth, and research and healthcare information systems are the various types of digital health. In summary, it's a digital patient management. And this is data from CDC, United States of America, and WHO in India. It says the commonest disease till today is a heart disease, that too a coronary artery disease, and diabetes mellitus. As there are so many other causes, stroke, Alzheimer's, accidents, renal, but these two are very common illnesses, not only India but globally. We will see in these two diseases, cardiac and diabetic, how digital technology can play a different role. We are aware of a portable ECG recorders and Holter monitors for quite some time, but they are not real time, and B2B event is not there. Remote monitoring is not there. Patient is there, it's a wireless, you can do that, but patient being in some other city, doctor or institution some other city, remote monitoring is not possible. A remote monitoring is now possible in cardiac digital health, where we fit in some wearables as a health sensors to the patient, and a continuous monitoring of the patient from outside the hospital setting, but monitoring inside is possible, especially for critical care patients with arrhythmia, patients who have undergone some procedures like stenting or cardiovascular surgery, or patients who have recovered from a heart failure. And these are all the areas where digital technology intervention support a cardiovascular disease. Here is the diagnostic side, here is the therapeutic side. Diagnostic side, ECGs, various arrhythmias can be diagnosed. A PA pressure can tell you this patient is going for a left heart failure, pre-left heart failure. And lung fluid level can tell you patient is in left heart failure. Pulse oximeter about oxygen saturation, blood pressure, diet, walking, sleep, pulmonary function test, and drugs, reminders, and adherence. On the therapeutic side, reaching a defibrillator to the site of VF, and hypertension management, hypotension management, and early cardiac failure. These are all the areas wherein digital interventions will help. These transducers or sensors are called as point of care equipments. So this is something like a blood pressure, this is something like a blood sugar, this is a PFT, this is an ultrasound, a pulse oximeter, all could be done, and even lipid abnormalities can be done and uploaded. And this is a stethoscope, which is a artificially enabled stethoscope. This is the patient can keep the stethoscope on. A patient can keep the stethoscope on the chest, and it could be connected to the mobile of the doctor at a distance, who can hear his cardiac sounds, pulmonary sounds, and abnormal sounds. This is very easy for a remote monitoring of the cardiovascular system. In times of corona, this will be really safeguarding the doctors' health. This is a Move ECG watch. Software is created and fitted inside the watch, which can monitor the heart rate, and atrial fibrillations can be transferred to his mobile phone as well as to the doctor's mobile. Now this is a US FDA approved Apple watches which have been okayed for an arrhythmia detection. You don't need a hospitalization to detect a cardiac arrhythmia. Tele-ECG is no longer a news. Long back, we used to take a ECG, scan it, and forward it to the cardiologist, tele-ECG. Now, after that, Sanket has come out very small ECGs which could be recorded by keeping your thumbs or keeping it on the chest. Now still recently, keeping your thumb, you are able to see your pulse rate, BP, as well as ECG. Very cheaper, very simple, fairly accurate, digital recording of ECG, blood pressure and pulse. And this is an ECG patch. Live Signals ECG patch is an US FDA approved. This patch can transmit the ECGs to the mobiles or a desktop. Zio patch is an important role, plays an important role in AF monitoring. You just fix it to the chest and his rate is being monitored digitally in the patient's mobile, and the institution AF monitoring can very well be done. This is recently in Singapore. I happen to deal with a very small machine which is being kept in the hand. This is a size of this machine. He keeps it here, in between two hands, and an ECG you will be able to see, and any dysrhythmia also we will be able to see. A pulse oximeter also will be seen. Very simple, and it can be transferred to the mobile which is kept here. And there is a small dysrhythmia that will also be seen here. Very easy ECG monitoring. This is a patch. This is a small skin patch which is digitally fitted to the patient's arm, which can monitor patients with hypertension. Blood pressure readings can be transmitted to the mobile. This is a tele-echo, which nowadays we are able to do it so well. This is at the patient end. An echocardiographer does it. Teleradiology, it is sent to the doctor's side and the reporting is done. Both in tele-echo, teleradiology today is a reality. This is now, we can do an echocardiography. You don't need a very big machine. A simple transducer and your app in your mobile can help you to do an echocardiography, a vascular Doppler and an abdominal ultrasound. Anything you can do that. You don't need very big machine. This is an ultrasound is being done. You can also discuss with your patient by the side. Very simple. And this is a eICU, tele-ICU. This is our own ICU. When I am outside my hospital, this tele-ICU I will be able to see in my mobile, and I will be able to instruct my team with postgraduates and staff nurses. And this is possible every part of the world. Inpatient data is transmitted to mobile with the vision of with access to NCD care at any time, anywhere. But the mission, what I have suggested is mobilize the healthcare. Mobilize the healthcare. And there are vocal biomarkers. As the patient talks to the doctor, from the voice itself, the presence of stress and cardiovascular disease can be detected. In Mayo Clinic, there is a software which has been developed and which has been approved by the American Heart Association in a scientific session 216. This is a very important one. This AccuPebble is a small chips which are wearable breathing and cardiac monitoring devices. We are able to monitor various parameters like sleep apnea or COPD, atrial fibrillation and asthma. AccuPebble. And on the therapeutic side, as I told you, a defibrillator reaching the site may not be possible in today's traffic. Distance is an issue. How to reach it, we will see. And then heart failures. This is a Soul's Life Vest. It's a wearable defibrillator. The patient is, wearing this, wherein there is an electrode. It can sense if there is a VF, and it can also, administer life-saving electrical shock to restore the normal rhythm, which can be monitored by the doctor also. These are the drones. In police and other investigations, we are seeing drones. Now drones can be used to fitted with defibrillators, and they can be remotely. This I happen to see that in Singapore in an exhibition, and it can self-flying drones are guided by GPS system and can reach the patient, and the shock can be delivered. And there are implantable devices which can monitor a heart failure. We call it as a high-tech, high-touch perspective, and especially heart failure and arrhythmia monitoring is very well possible here. And in heart failure, usually by arrhythmias only precipitate, especially an atrial fibrillation. If we are able to monitor an atrial fibrillation by the Apple Watch, we will be able to immediately treat and prevent. Another thing is a heart failure. That is pre-heart failure. If you can measure and monitor the pulmonary artery pressure, we will be able to say it is going up. This patient will land up in cardiac failure tonight. Left heart failure has to be shifted to the hospital. When he has developed it, he can have a sense vest he can fit in, and the pulmonary fluid status can be monitored, and you can make the diagnosis as pulmonary edema, not a respiratory cause for his disability, and can offer the adequate treatment immediately. This is a very recent one. They found out in our own, All India Institute of Medical Sciences, Delhi, Professor Deepak Agarwal.
So weeks here itself in this cubicle, we have all these patients here for years together, and the only reason we're not able to send them back home is because they need to be sent on a ventilator, and the patients were waiting for, we have a waiting list of more than 5 years.
The major disadvantage is the availability of ventilators and the cost. Now AIMS has devised a small ventilator which runs on a mobile phone. You see this patient who is here in the hospital for about years together for ventilator. Now this patient has been discharged and he has gone home, and where through this this ventilator, which is controlled through a mobile, is comfortable. Patient can be at home, very less expensive, easy to carry, not bulky.
Compared to normal ventilators, this device, if you look out here, this is extremely portable, very small, weighing less than 3 kgs, and it runs off an Android phone. So one thing we realized was that most patients and relatives, they own a smartphone, and we wanted something to make which was very user friendly. So we designed an app.
Have a look at the traditional ventilator. This is how big it looks like. But at the very same point of time, this is the size and the form factor of our ventilator. So it is exactly the same as the traditional ventilator, while being a fraction of its size and a fraction of the cost as well. Now, if I talk about this ventilator, this comes with a lot of shortcomings where our ventilator actually supersedes. So when we talk about this ventilator, it needs oxygen supply, it needs medical air. So if a person wants to take it home for a long-term ventilation, we cannot take it over there. Whereas with our ventilator, you simply plug it into the socket and works just fine.
We have prices less than 50,000 rupees. That's the basic price for the basic version, and the running cost is less than that of a tube light. Easily 5 years shelf life is there for this.
इसके वेंटिलेटर लग गया, हाथ तक कोई काम नहीं करते थे कि एक बंदा तो हॉस्पिटल 24 घंटे रहता ही था, मतलब चाहिए रात और दिन। हम वहाँ पर रोते थे, हम बहुत दुखी थे, हमारा कोई देखने वाला भी नहीं था। हम वहाँ पर किस तरह गुजारे 5 साल, हम 1 रुपए के लिए मोहताज हो गए, हमारा कोई कमाने वाला, अकेले थे।
இது ஃபாஸ்ட் ஆக்க முடியாதா?
उनकी वजह से आज 5 साल बाद हमारा बेटा घर पे है और हम अपने घर को भी देख रहे हैं।
Now coming to we have seen something in the cardiovascular side. On the diabetic side, why digital intervention is needed? Blood sugar has to be controlled 24 hours. Then continuous blood glucose monitoring is needed. And you must be able to recognize hyperglycemia, hypoglycemia, and recognize cardiac and neural complication. This is the monitoring side of it. That is the diagnostic side. This is the evaluation type. Blood glucose, BP, diet, exercise, drugs, walking, drug administration, sleep. On the treatment side, artificial pancreas, hypoglycemia monitoring, cardiac dysrhythmia monitoring. These are all various sensors that could be used painlessly to, monitor without a needle prick. They can pick up the blood sugar, can be transmitted through to the doctor and the patient through mobiles. This is a teleophthalmoscope. That is, you are able to see the, you need not, poke into the cornea. You can just keep it here, and very nicely on your mobile you are able to see the retinopathy, which will detect the vascular changes, and that can be in a distant, far off place, unreached place, and the doctor can see that in his computer. That is a digital ophthalmoscope, teleophthalmoscope. There are a lot of apps available to control the weight, called as a Healthify Me, a heart rate, stress level, breathing, food, walking, everything is at your fingers. This is a method of monitoring blood glucose without having a pinprick to the earlobe, through the cornea, from the tears, and this is transferred to the mobile, a continuous glucose monitoring without a prick. And then this is an intelligent toilet. In the toilet itself, your urine sugar and blood sugar and BMI could be measured. Very intelligent toilet. And these are various sensors which are fitted into the patient's body. This is fitted in the teeth to disperse the tablets at the right time. And this is put inside the stomach. See whether your drugs are being adhered to. This is the AcuPep, and this is the mobile sensor. This is what I told you is a contact lens, wherein from the tears it can check the blood sugars, and this is a painless way of taking the blood sugar, continuously monitoring, which is available today freely in Indian market. We are doing it in our own patients, in our institution, are able to see the HbA1c also. This is a wearable healthcare, wherein a small sensor is being fixed and the blood sugar being continuously monitored and is being transferred to the caregivers or parents, what we call it as a personalized diabetic care. This is an artificial USFDA approved artificial pancreas, which can sense the blood sugar and also administer the insulins. And Omnipod is another instrument which the patient can wear and assess the blood glucose, and also insulin could be administered without any hypoglycemic episodes. That is more important. In D1, hypoglycemia is very common, and this hypoglycemia is very well associated with PQRS abnormalities with abnormal QT intervals. This hypoglycemia monitoring can be done by D1 Namo app. And lifestyle medicine is a new field. All of us know that lifestyle is the common cause of NCD. NCD is cardiovascular disease, diabetes, COPD and cancer. Therefore, a lifestyle medicine has come up. Even API is coming out with a monogram on lifestyle medicine and also a certificate course in lifestyle medicine. Lifestyle is the way in which we live and what are all the diseases involved in it, and how to control that by diet, by physical activity and adherence to certain habits. All those things will be there under a new specialty, lifestyle medicine. And tele-wellness is another new science which is coming up, where how to keep your wellness. Disease is one, wellness is one. In people who have got the disease, they can go for wellness, or without getting the disease also you can go for wellness. And this is done through the wearables which tell you your physical activity, diet, weight, sleep, BP, sugar, heart rate, which will guide you to and lead you to your wellness. These are various wearable healthcare devices, and a Fitbit surge is there. Enormous number of Fitbits are available in the market today. Tele-wellness is a prescription. It is said, take 2 wearables, prevent your disease. This is a statement which is being said. And we have come out with a digital health card. I have worked with some digital group, and all your data. Something like a sari shop, we carry big boxes of bags of CT, MR, this and that. Here something like your credit card, one card is there which can accommodate everything, which can be read on your mobile or on your desktop also. And there is an app we called as a Hello Doctor, which links the patient with a doctor anytime or with a health worker and an appointments. All these things could be done. These are all digital management. What is the future of digital technology interventions in cardiodiabetic medicine? One is pharmacogenomics, managing the drug therapy, nutrigenomics, managing the diet therapy, and putting a doctor inside the patient. Instead of monitoring from outside, how can you monitor from inside? What's the role of artificial intelligence? Internet of Things, what is its value? Digital 3D imaging. Pharmacogenomics, as we all know, one drug at one dose works for X, that doesn't work for Y. That is why we need a genomic assessment. Therefore, drug dosing decisions to reduce the morbidity and mortality can be well done, especially in a diabetic patient. Nutrigenomics is which food you should eat and what you should eat, how much you eat. This is a hit in 2019 onwards. Nanotechnology is you can have a breath sensor which can make the diagnosis of diabetes. Also, you can make a diagnosis of ketoacidosis. Sometimes a small chip can be kept inside your body and it can monitor all your vital parameters. This is a small chip kept inside the patient who has undergone a femoral head replacement to detect the thrombus as well as the catheter infection which has been kept inside. Now it is being applied in many areas. Artificial intelligence, we humans are known for intelligence. When machines take up the job of our brain, we call it an artificial intelligence. It can be a machine intelligence and a natural intelligence. And AI, what is the importance of AI is in cardiovascular disease, the risk score is being done well and can always predict this patient who has got a cardiovascular disease will go into these complications. For example, a long-term diabetic with tobacco, all those things, you can say this candidate will go into a early myocardial infarction. Even in a myocardial infarction, by analyzing the data, it can say this particular patient has the highest risk of a death. That is the value of artificial intelligence, that is predicting heart attack and death. And this is a recent one which has come out, IoT, Internet of Things, that is connecting devices to the internet and to each other using wireless. Now, Internet of Medical Things has come, IoMT. All the data could be transferred to the digital, all these could be transferred to the clinicians and to the institutions for analysis. And this is a 3D imaging.
Right here, I can show you the anatomy as it was at the time of death. So everything is accurate. There's no rendering done since the cadaver was flash frozen. There were scans that were taken of the cadaver itself, and then from there you can see the anatomy as it was at the time of death.
For the medical students, it may replace an anatomy theatre. For the clinician, it may replace a CT scan, MRI, PET scan, everything. Anatomy, functions, everything can be seen by the hand. You can see the entire system, GA system, cardiac system, or brain, anything we will be able to see.
In this case, you can also have concurrent views of, let's say, the musculoskeletal system, and also start moving different areas to see regional anatomy and other areas.
You are able to see the liver and the heart here.
Anatomy as a whole, you can also see regional anatomy. So in this case, I have female head and neck.
Total.
There is something that you find in surgery.
You can isolate the heart. You can cut it into any segment, any section, and see that.
The relationship between the skin, the fat, and other structures. And as I showed you earlier, you can go ahead and also remove structures here. Press this undo button. And what's interesting is these are actually the scans that were done from the cadaver. So everything you see here is what we saw at 0.6 to 0.8 millimeter thickness. And so each time I turn around, the slide.
You can see the brain. Any part of the body, any segment, you can locate for any anatomical defects. Now, ladies and gentlemen, you will all agree with me. Digital healthcare is an intersection between two giant sectors, life sciences and technology, biology with technology. For the developed world, digital health is an additional option. But for the developing world like ours, digital health is the only option. The old statement is an apple a day keeps a doctor away. An app a day keeps the doctor away. Today, it is digital doctor. Is our digital prime minister who wants to make the entire country digital, and we are making a digital health. This is my meeting with the president of Sri Lanka. With my Commonwealth colleagues. Sri Lanka has well developed system. Like we have a personal account number. They have a personal health number, PHN, through the digital system. Throughout the country, you go there, your data will be there. I am sure, ladies and gentlemen, we will adopt digital health not only in cardio-diabetes medicine, but in other aspects of medicine, and see that we do the best services to our humanity. Yes, colleagues, you are all convinced that today we are living in a digital era and tomorrow is for digitalization. Our Honorable Prime Minister is talking about a digital India. We clinicians are talking about a digital medicine, a digital handling of the two common diseases, cardiovascular disease and diabetes, under the heading of cardio-diabetes medicine. Thank you all.